An illness outbreak announced last week has put the spotlight on a Northeast Florida dairy farm. A warning from the Department of Health said nearly 2 dozen people were sickened after drinking raw milk from the dairy, including children. Several were hospitalized. Joining us via video to discuss the risks and purported rewards of this wellness fad, we are joined by public health expert Chad Neilsen. He is the director of infection prevention and control at Nemours Children's Health, and he joins us remotely. Thanks for being here, Chad. Appreciate it.
Good morning, Ann.
We also want to hear from you. If you're listening, do you drink raw milk or have you ever tried it? What has your experience been? Give us a call at 904-549-2937 or email us at firstcoastconnect@wjct.org. So, Chad Neilsen, first of all, can you just sort of indicate for us how significant is an outbreak of this size?
Well, when we look at outbreaks, any outbreak of any size really depends on the organisms or what sort of the causative factor is. But what I will tell you is this is an outbreak that is relatively preventable, right? Raw milk has known risks dating back for decades. This didn't have to happen. So to hear that 21 individuals, and I believe it was 6 kids, were involved with this, something that was totally preventable is really unfortunate, and it is sizable. I will say there have been larger raw milk outbreaks out in California and the West Coast, but this is not insignificant because a lot of individuals are harmed by this.
And so Florida is one of about 20 states that does not allow the sale of raw milk for human consumption. In fact, it has to be labeled not for human consumption, as this milk at this particular dairy. Um, and so the people that are buying it are choosing to drink it in spite of that prohibition. But there are about 30 states that do allow the sale of raw milk. Can you indicate what we know about why people are motivated to drink it in the first place? What are the purported benefits?
So I think this really goes back to the 90s and sort of the organic health food movement. And that movement really posits that anything that we're adding to or sort of fiddling with our food is making it unhealthy, right? And I think some of that, in fact, is true. We know that research supports that ultra-processed foods are bad for us, and that the more we limit them, the better it is for our diet and our overall health. And so I think some of that has gone a little haywire in today's social media and other landscapes. And so I think what this idea of raw milk being healthy or more healthy is largely not based in science. It's not based in evidence that's been researched and tested. But what some of those proponents of raw milk are saying is that raw milk is more healthy for you because pasteurization essentially removes nutrients, or it makes nutrients not as, quote, bioavailable. It could help with allergies and sensitivities. All of these claims are popular about raw milk, and unfortunately not many of them have been researched well and shown to be true.
And so pasteurization is what is traditionally the treatment for milk. And as you say, it could, in the claims of people who support raw milk, they believe that it knocks out some of the essential products or qualities of milk that could be beneficial. What does pasteurization do to help control disease, though, when it comes to dairy milk?
So let's talk about what pasteurization is. It's discovered back in the 1860s by Louis Pasteur, and he kind of fell upon it as he was trying to address the problem of spoilage in liquids. During that process of him trying to figure out spoilage in liquids, he recognized, like we do today, that food and beverages can harbor harmful bacteria and viruses and pathogens in other ways. And by pasteurizing it, that is to say, by heating that liquid up to a certain temperature, it essentially renders it safe and it kills all of the microbes that are in it. So there is a small amount of nutrients that are lost in pasteurization, but it's not enough to overcome the risks of all of the bacteria and potential for viruses that exist in that raw milk. Pasteurization now is really standard practice across most of the modern world. If we didn't have pasteurization, we'd see many more foodborne illnesses in outbreaks and amongst our communities, and they'd be a lot more common because we use pasteurization for nearly everything dairy related, from cheese to ice cream. So it's a very important public health tool to render food that we eat and drink every day safe.
I want to talk a little bit about the kinds of illness that were linked
Mhm.
to this outbreak, but I do want to just say, first of all, the farm is that was identified by the Department of Health is in New Smyrna. It's called Keeley Farms Dairy, and they put out a statement that basically said that they were blindsided by the Department of Health announcement, that they had not been informed of any investigation, and were not contacted by the agency prior to the statement that was issued publicly. They have not been notified. They say that they had, quote, committed any wrongdoing. And they also noted that they do label all of their raw milk as not for human consumption, which is something that they're required by the state to do.
Mhm.
But this outbreak was linked to a couple of kinds of bacteria, I guess. The Shiga,
Shigella, yeah.
Shigella and, Campylobacter?
Mhm.
Is that, am I saying that correctly?
Yeah, you're doing great.
Okay. So, I mean, I those are both illnesses that can produce really violent, responses in
Mhm.
people who've had them in a gastrointestinal sense.
Mhm.
Can you sort of just let us know what it is that they are responsible for? And then beyond that, if we're talking about severe complications, which I guess
Mhm.
at least a couple of these people had, what that can bring.
Right. So when we look at the risks of raw milk, we frequently talk about bacteria. And some of those bacteria, as you alluded to, Campylobacter, E. coli, or what we call Shiga toxin producing E. coli. So it's sort of a toxin that certain strains of E. coli have. These bacteria and their toxins cause gastrointestinal illness, much like what you hear about on cruise ships or sort of other sort of gastrointestinal illness outbreaks, right? You're talking about vomiting, diarrhea, stomach cramping, things of those nature that generally speaking in most individuals, they can fight off and overcome. Maybe sometimes they need antibiotics to help them. But in really severe cases, particularly amongst those who may not have good immune systems, children, pregnant women, those types of bacteria can become extremely dangerous and really increase their risk at hospitalization. Because if you can't clear these bacteria from your GI tract or your system without antibiotics or even with, you can end up in the hospital with more severe complications, which could lead to all sorts of issues. We're talking surgical intervention on your guts and your intestines, the potential for septic shock, all sorts of really negative health outcomes can be found if this is a very invasive case of these bacteria that you have.
If you're just joining us, we are talking about the recent raw milk disease outbreak linked to a dairy here in Northeast Florida. If you'd like to join our conversation, you can give us a call at 904-549-2937 or email us at firstcoastconnect@wjct.org. We've got a call from Carolina on the south side. Good morning. Go ahead.
Hello.
Good
Thank you
morning.
for taking my call.
Sure.
Hi, good morning. I'm a physician in town. Thank you for taking my call. But I often get questioned about is it safe to have raw milk, especially for children, and I recommend not. And if they do buy raw milk, I tell them to scald it at least. The progress that we've made with pasteurization and in science is just so under attack. And physicians have an obligation to do no harm and to do good, but the people that post these things or share this information online have absolutely no responsibility to anyone getting sick, and they don't answer the call at 3 in the morning when someone is ill. So it's very frustrating, and just so, it makes me so angry to see that people are hospitalized because of the inadequacies of ethics in this situation. Thank you.
Thank you so much for that. Chad, there obviously is that element to this. A lot of social media influencers making all kinds of health recommendations these days. And, raw milk is one of those that you'll find a lot on TikTok. Of course, you'll also find, as we noted earlier, the Secretary of HHS, RFK Jr., drinking it and advocating for it. So there are people who perhaps don't have any training. And then there's also people in positions of great authority singing its praises.
Yeah, that's right. And what that does is it creates this landscape, as Carolina the caller mentioned, that it confuses the consumers. It confuses the general public when they hear messaging from the government versus their doctors or their nurses at home with conflicting guidance. And so I think it goes back to sort of the previous conversation you had with Dr. Corin in the previous segment, that public health really is under attack. Medicine is under attack. Science is under attack. If people who have these questions really want to think about what is my risk and who do I listen to, nearly every medical and health agency of any kind of authority recommends against certain things, and raw milk is one of them. Right? The CDC and the FDA themselves currently advise do not consume raw milk. The World Health Organization do not consume raw milk. The American Academy of Pediatrics do not consume raw milk. So I think it becomes very difficult, I think, for the average everyday consumer, especially those heavily on social media, to understand what is true and what's not. But I will always go back to say, what are the sources? You don't need a graduate level degree in epidemiology or public health or medicine to determine if something sort of smells fishy in the research. I always say, who's benefiting from this? Who's trying to sell you raw milk? Why are they trying to sell it to you? As the caller very explicitly stated, they have no accountability to you, yet they are probably profiting off of the decisions they're trying to encourage you to make.
We've got a call from Tom on the west side. Tom, go ahead. Are you there, Tom? Perhaps not. Maybe he's on hold still. I want to add, we've been seeing some pictures for people who are watching our live stream of the dairy farm that was linked to this outbreak. They recently posted to their Facebook page a statement from another supporting dairy farm that's located in DeLand. And one thing that farm noted was that this is not, as they believe the media has sort of been reporting, all of a sudden 21 people sickened, but it actually is 21 people sickened since the beginning of the year, since January 1st. I'm curious if that gives you any comfort. And then also the question of kind of what is causing this. The posting also said that they believe this is something stemming from improper storage of raw milk as opposed to something that was inherent in the product when it was sold. I'm just curious your thoughts about both of those things.
So regardless of whether 21 cases were related to a very sudden outbreak or 21 spread over several months, an outbreak is an outbreak when you have an unexpected event in a population over a period of time. And so regardless of the time period, raw milk being the causative agent is dangerous nonetheless. So as it comes to the company or the farm that is sort of pushing back against this, the Florida Department of Health has epidemiologists like myself all over the state of Florida working these cases. And so what they're doing is they're finding reports of certain infectious diseases from hospital records or from calls from consumers saying, hey, look, I got sick with this. And so then those epidemiologists for the state of Florida start sort of unraveling the yarn ball, and they start looking at different things related to what did that person eat, what did they consume, liquid-wise, where have they been, and they put this very complex puzzle together to determine sort of where this pathogen or where this contaminated product came from. I won't pass judgment on this farm. Certainly they are following the law with packaging their products. It's primarily raw milk is provided for the consumption by animals or pets. But I think nonetheless, we know how to do epidemiology here in the state of Florida. The state health department is very good at what they do, as well as their epidemiologists on the regional and the local levels. We have to trust in their guidance when they say this is an outbreak and what steps to follow. Storage of raw milk, depending on how it could be stored, absolutely. It could also amplify the bacteria or the viruses that are in that milk. Along any kind of perishable product, if you're not refrigerating it appropriately, it warms up, giving pathogens the ability to start to grow and reproduce. And so that's why we tell people, it's a joke during the summer, don't leave potato salad out in the sun or don't leave leftovers out, because as that food warms up, it allows bacteria to grow. So is it possible that it was due to storage? Absolutely, possibly, but nonetheless, the consumption of that milk, regardless of where it's from, if it's raw, there is a risk.
We had a comment from Regina in Mandarin saying we all pay when people do this stupid stuff. Chad, just very, very briefly, do you think, given that this is based on reporting from physicians, that this outbreak is larger than 21 people?
So that's a good question. It certainly could be, and I'll tell you why. When we form the idea of an outbreak and we go through all the steps to confirm it, generally speaking, we have to have lab-related results. So someone went to a hospital or a doctor's clinic, they gathered a sample, the sample was positive for this, and then they connect it to food or wherever they got it from.
Chad, we're going to probably have to leave it there. I apologize, but
Sure.
thank you so much, Chad Neilsen, for joining us today. Really appreciate it.
Absolutely.